Well, thank you so much, Chairwoman Eshoo, and especially for holding this incredibly important hearing today. And thank you to all of our witnesses for being so patient with us and our very many questions as well. I appreciate especially the focus on the drivers of health disparities, race, ethnicity, sexual orientation, gender identity, and social determinants of health like access to transportation and housing. I represent a district that is equal parts urban, suburban, and rural. And many folks living outside of the major cities don't have reliable access to in person appointments with medical professionals. I was recently appointed to serve on the Select Committee on Economic Disparity and Fairness and Growth, where I'll have an opportunity to address the economic inequalities faced by rural communities, disparities that have a direct impact on healthcare access and outcomes. I'm also a proud co-sponsor of many of the bills up for discussion today, including H.R. 2503, the Social Determinants Accelerator Act. Introduced by Congresswoman Bustos, this bill would create a program at CMS to provide grants to state and local governments to develop plans to combat social determinants of health that are negatively impacting health outcomes. With that, my first question is to Dr. Odom Walker. Rural residents in my district face long drive times to the doctor and lack of high-speed internet. For instance, rural Minnesotans seeking inpatient mental health and chemical dependency treatment must travel 3 times longer than urban patients on average. And many in my district have limited to no broadband access, making it very difficult to reach them via virtual healthcare. This lack of access undoubtedly leads to worse health outcomes, and it's not an uncommon story in my part of Minnesota. How could the Social Determinants Accelerator Act, Dr. Walker, which invests in state and local capacity, help rural communities fight these factors that are leading to negative health outcomes?
Thank you for the question, Congresswoman. I think it is unique, and one of the opportunities with the Accelerator Act is to think about how you invest at the local level, to hear from stakeholders, hear from communities about their particular situation and needs. For example, maybe a strategy that could be invested is a telehealth kiosk that's at a local entity, a community center, something that's commonly available to provide that telehealth and broadband access in a stable way. These are the kind of ideas that some have deployed, but it needs scale. It needs, to do more of it where it works, because just putting telehealth into place doesn't necessarily overcome those challenges. And if you have to drive 3 hours to the doctor, that also is not necessarily addressing the challenges of rural communities. So really trying to figure out how to make it unique for the community that we're talking about, and making sure that we're looking at the right lens, the right problem, and with the right data is really important in this bill.
Thank you so much, Dr. Walker. My next question is for Dr. DeSalvo. I'm a proud original co-sponsor of the Black Maternal Health Momnibus Act, which includes H.R. 925, the Data to Save Moms Act. One provision of the Data to Save Moms Act would provide funding to promote representative community engagement within maternal mortality review committees, which are multidisciplinary committees in states and cities that perform comprehensive reviews of deaths during or up to 1 year after pregnancy. Dr. DeSalvo, why is it important to gather a diverse range of perspectives in maternal health data collection and reporting processes, including through the elevation of voices and experiences of people from communities most severely impacted by our nation's maternal mortality crisis, particularly communities of color?
Thank you for the question, Congresswoman. We have an expression in public health that the work needs to be done with community, not to community. And that particular part of the Momnibus package describes that so well, that it's not just about experts looking at the data, people in medicine, or even public health professionals. It has to be done with community to understand what's being seen. and how to identify appropriate interventions that are culturally appropriate, linguistically appropriate, and are going to meet the needs of the community. So that kind of engagement is essential really when we're tackling major public health challenges like maternal mortality, which is higher than any other high income country and rising in the US, and particularly acute for communities of color. So the suite of bills not really helps us understand it's quantitative, it's the voice of community, and as you've raised in the prior question, it's a multi-pronged approach. It's not just about great medical care. We have to make sure people have access to the social needs being addressed as well.
Thank you so much, Dr. Salvo. And with my time expired, Madam Chairwoman, I'll yield back.